Let's dive into the discussions shaping the nation.
Jaskin Corlia, Ara for Martinier, Gur Sholu Litraha, Giavile, Yahed, Agachaska, Chaila, Queen Scaniel, Tobash, Modula, Operagy, and Croman Yanley. August at Tushmori Gofol, Faraga, now will annulus, a hortifo and Oireachtas, na on the hospital. Minister, yesterday we learned the scope and scale of the devastating hip surgery scandal. 2,260 families have been sent letters. I raised this issue here in Leaders' Questions in March, 2 months ago. I called on the government to get ahead of it. I told you and asked you to tell parents what was going on, but parents are still being kept in the dark, even today. And what does it say about your government that facing into this scandal, it took 2 months for you to even ask CHI how many children were affected, how many letters have been issued? The Taoiseach this week was still trying to downplay these letters, suggesting they were issued to reassure parents on the back of a media leak of the draft report. That is nonsense, Minister. These letters were sent out to implement an early recommendation of the draft audit. The recommendation calls for the recall of all these children for follow-up. And why? Why is the CHI implementing an early recommendation of the draft audit? Because the draft audit is shocking, it is devastating, it is damning. The draft audit states that 60% of surgeries in one hospital and 80% of surgeries in another hospital were unnecessary. Now just let that sink in. Let it sink in for a moment what that means. Children as young as 1 have had their hips opened up, cutting into their bones. They've had to learn how to walk again. They've been left with scars for their life. And now to find out that these surgeries may have been unnecessary. Imagine having to bring your 2-year-old little girl into that operating theatre, having to leave her in the hands of the system, only to find out that the surgery, the pain, the learning how to walk again, that scar that she has on her hip was now never ever necessary. The surgery didn't need to happen. Because that's the experience of so many parents out there. It's the experience of one mother who I spoke to this morning. In 2015, she brought her little girl, 2 years of age, for surgery on her right hip. It was the only hip that was ever mentioned in all of the assessments. After the operation, she was told that she needed surgery on the other hip as well. She described feeling like a rabbit on the headlights, but like any parent would, she followed the medical advice. And after 5 weeks, her daughter had the second operation. Now, this letter dropped in her letterbox 7 weeks ago. She was immediately concerned. She sent 30 emails over a period of 5 weeks to CHI without one response. Only when she got her solicitor involved did she get a response. She sought a second medical opinion. She is now sure, Minister, that the first hip operation at best was premature and the second operation wasn't needed at all. At all. She is frustrated at the lack of answers from CHI and from the government in relation to this. And this isn't an isolated case. Every family I've spoken to over the last 2 months are looking for one thing more than anything else. They want to know if the surgery that was carried out in their child was necessary or not. And the audit is not going to give them that answer. The audit is an anonymised study. It won't give them the individual answer. You're asking parents to wait. You're asking parents to trust the process, but trust has completely broken down. So I have a simple question for your government here today, and it's on behalf of parents that have contacted me, Deputy Culnan, Deputy Carthy, and many others in our party and across the benches. Can you tell me that every single one of those 2,260 anxious families, that every one of their children will have access to an independent clinical assessment that will answer the simple question for them whether their child was operated on necessarily or unnecessarily? And when will they be given access to that clinical assessment?
Minister,
I asked you 2 months ago to get ahead of this. It is not fair that we've left families in this situation for that period of time.
Thank you, and ask Ken Corley, and thank you, Deputy, for raising this matter. I think we agree on a number of things here. I think we are all working on behalf of the children that you've mentioned. We are all working to make sure that we get answers to what's happened here, and we've discussed this a number of times in the chamber here. We are all extremely concerned at the thoughts even of a child having a surgery where that was not necessary. I think we can probably all point to somebody we know or somebody who has come to us where they've either been recommended the surgery and haven't gone through with it, where they've been recommended it, they've gone through with it, it hasn't been needed, or indeed where they've needed the surgery. And what we need to get to the bottom of is, where have surgeries been conducted on children, been provided where it wasn't needed, where has injury been inflicted on young people where it simply wasn't needed. And the most important thing that we need to ascertain at the outset is the facts, and that's why this review is taking place. And I appreciate we all want to know the facts as quickly as possible, but we don't have those yet. And I know you're pointing to and making reference to parts of the report. The report hasn't been published. The Minister hasn't seen the report, and while it's been very clear to her that she will have the report in the coming weeks, we don't yet have the absolute facts of the review that's taking place. So I think we all have responsibility in this chamber to make sure that what we're speaking to and what we're talking about, it's based on facts and reports that are published. Secondly, it's important to make sure and to assure families at the moment where there are surgeries taking place, because we know that there are children that do need surgery today, that there are revised procedures that have been put in place, there are new protocols in place where all surgeries are being assessed by a multidisciplinary team before any decision is being taken. But there's also separate work being done, and that will follow through from the review to make sure that absolute best practice, that up-to-date practice that's in place in other countries and that should be in place here, that is adhered to if any child is being put forward for these potential surgeries. In terms of the overall numbers, and again I think we have to be very careful here, the figure of just over 2,200 young people is not a figure that is suggesting every single one of those young people had surgeries where they shouldn't have had them. And we have to be clear about that. It's important that these families have been written out to. It's important that they have been engaged with by CHI, but also by CAPA. We know that 1,700 of these were with CHI, 500 of them were with CAPA, that they've been engaged with, and where there hasn't been follow-on in these instances, that now begins. I know for a lot of these families where surgeries have taken place, they have had follow-on, they have had engagement, they have had consultation with their consultants, with their teams, and those who haven't, there's a very clear commitment that that engagement and that consultation would happen immediately. So the most important thing here, as you said at the outset, Deputy, is that we ascertain the facts. What has happened here? What practices were followed? How many children were impacted? What do we need to do now? And above all, and to your point, how do we make sure that any follow-on support, any medical support, any assistance that's needed by those families and those children, that is provided immediately? But we have to get to the bottom of this and the facts, and we will have those. We don't have that yet. We don't have that report. We do know that the initial recommendation, as was published by the CHI in their statement this week, is the reason that they have sent out the letters to families to make sure that that engagement starts immediately, that we're not just waiting on the report, but we do need to have those facts and that information to make sure that any practice moving forward ensures that this doesn't happen again, and that above all our children, who we expect when we go into our hospitals, when we're given advice and medical advice, that we can stand by that and that we know the best practice has been applied in every single case possible. Thank you.
With respect, that's not good enough. The fact is that 2,260 letters were issued. The fact is the letters were issued as part of the implementation of a recommendation of the audit, the draft audit. The fact is the draft audit said that all of those children should be recalled. The fact is there's 2,260 families out there that are anxious, that are worried. The fact is none of those families know whether their child was operated or not. The fact is your government has no plan at this point in time to provide a pathway that will allow them to determine if that is the case. The audit is not going to tell them that. I asked you 2 months ago to get ahead of this. I pleaded with you, and we've given countless examples of families who are no longer waiting for government. They're seeking the second opinion. They've gone to America. They're going to London. They're putting their hands in their own pocket because government are giving them no answer. The fact is, this parent that I talked to this morning sent 30 letters without a response looking for information. Minister, you need to deal with this. I know every single person in this chamber would be appalled at the idea of a young girl being opened up, her bone being chiselled into, unnecessary, left with a scar, that pain. But it is your responsibility of government to provide a pathway, to provide certainty for those families. I ask you a simple question. Will you ensure that every single one of the 2,260 families that got that letter will be given an independent clinical pathway to determine whether their child was operated on unnecessary or not? Minister? That's the first question they want answered.
Deputy, I can't be any clearer with you on this. we firstly need to ascertain the facts. We need to make sure that we have absolute clarity as to what has happened, how many people are involved here, and how do we make sure this never happens again. At the same time, we need to make sure that where families need follow-on care, where they need further information, where they need further clinical support, that is provided. And I think the Minister for Health couldn't be any clearer in the commentary that she has made over the last number of months. Any support that families need, any support that children need, going as far back as 2010, and obviously 2010 was chosen because 15 years is the skeletal reference age of which a child matures and their bone density. So that's the parameters of which have been chosen. Any child within that time frame will be provided with the support, and their families as well. That's why those letters were written out initially. Many of those families will have had continued engagement. Many of those families where surgeries happened years ago will have been engaging with their teams, will have had that support. But for those who haven't, and I accept that there are those who might not have, who don't know whether the operation should have happened or not, we need to make sure that we find that information as quickly as possible. And of course, there is, without a shadow of a doubt, no question as to the fact that they will get the support, the assistance, the medical support that they need if this has not been done correctly.
Like, share, and subscribe, and let us know your thoughts in the comments. We'd love to hear from you.